through everything as we can. Sorry, we're going old school, but I am old, so this is what I'm comfortable with. I was going to try and get you a PowerPoint this year, and I looked at it and I went, we're just going to stick with the old school. So this is one of my favorite cartoons to put up. The first step is to identify the injury. Can anyone tell me whether this is a hairline fracture or a compound fracture? With the school nurse out of the building, Todd's broken arm was cared for by the third period health class. When I used to show this, I actually had my own sports medicine class. I was very lucky. In my last job in Illinois, I could get some vocational training and I was able to teach my own course. I've had a very interesting past. Some people think I've just graduated, which kind of makes me sad. I must not sound very intelligent. But I actually, when I was in high school, we didn't have a class like this. You didn't have opportunities to learn what kind of people are out there. You knew you could be a doctor, a nurse, a physical therapist, an x-ray technician, a dentist. That was probably about all you thought you were able to do in healthcare. Now, there are so many nooks and crannies where you can create a job that doesn't necessarily require a 4-year or a 7-year, 8-year degree. So be very careful about finding what interests you, not finding, well, that's the only thing I saw in the pamphlet kind of situation. Because, again, would I have done things differently? Possibly. So when I was in high school, we had an opportunity to do the CNA class, but the CNA class was not technically through the high school. It was through like an NTC, and not everybody got to sign up. They picked one kid from each high school, and I happened to be picked from my high school. So I would go to school in the morning. For 6 months, I went to school in the morning at high school, and then the rest of the day, sometimes into the evening, I was doing my CNA class for 6 months. Do I recommend that for you if you're interested in healthcare? Absolutely. Number one, you don't have to stay a CNA. But what it provides you is with a lot of base knowledge that can be utilized in a lot of different medical careers, all right? The other thing is, it looks good on a resume, college applications. The other thing is, I was constantly finding work. I'd come home, they would be calling me at college. Are you gonna be home this weekend? When is your break? I could make a lot of money doing something that was gonna actually further me in my career down the road. So don't think because I'm going to be a CNA I can only work in a nursing home. I don't want to work with old people, which is very sad because that's probably, if I was ever going to go back into nursing, which I'll get to in a second, I would probably go back into geriatrics. I love geriatrics, all right? But there are so many ways that they're using CNAs now in the hospital settings as well. Those opportunities weren't available either to me. You worked in a nursing home. That's where you got a job if you were a CNA. So again, you want to take a good look at the CNA course if you haven't already. It's just a really great opportunity for kids. So a little bit about my background. So after high school, I went into college at UW-Oshkosh, and I got my bachelor's in nursing. I'd always thought that's what first I wanted to be a pediatrician, then I wanted to be a nurse midwife, then I decided on nursing. And my senior year, I can still remember this day. One of my, kind of not a close friend, but a close friend that I was in sports with and stuff like that. And we were talking about what our plans were. And she goes, well, I'm going to go into sports medicine. I said, what is that? God darn it, what is that? And back then, it was a very, very broad term. It actually meant next to nothing. But at the time, I thought, shoot, I've got my scholarships, I got my college plan. I wasn't a risk taker back then, so I just went ahead and I did all the nursing, and I started to keep thinking about that sports medicine part of where she was going. And, so I finished, and I was out in my first job, and I love nursing, but I just didn't think I wanted that setting for the next 50 years. So one day I went to my hometown library, which is very small, kind of like a Wausau size. Went to the library, found a book on athletic training by chance. That's what kind of popped up in the card catalog. I actually was born in the year with the card catalog. Some of you might see that in old movies. and there was one textbook, and I read it from front to back, and I said, that's what I want to do. It took all the things that I loved about nursing, put it in a different setting. So, when you're talking about sports medicine, it's kind of like an umbrella, all right? A lot of people fall under the term of sports medicine, and back in the day when I started to do talks and had my own class, I tried to tell kids, you got to be very careful when you're looking at what you want to do, that you make sure when you go to your school that you're going to walk out of there with an ability to get the job you want. A lot of people were going to colleges and getting degrees in sports medicine, walking out of college, and they couldn't get a job because they didn't have all the right tools, right certifications to get a job. So you've got to still be a little careful when you're out there kind of looking at all the things that are available in healthcare. But in terms of sports medicine, there are different kinds of people that fall underneath that umbrella. Orthopedist. Who knows what an orthopedist is? Carson Schemenauer. What's an orthopedist? Cam. What did I say?
You said Carson Schemenauer.
Wow, that's a name I haven't said in a couple of years. Wow.
Cameron Schmeiser.
Well, it's CS. I'm an old lady. What can I do? Too much tough skin I've been sniffing. You've met an orthopedist.
Dr. Messley?
Nope. Who else have you met?
Dr. Keel?
Dr. Keel. Dr. Keel is an orthopedic surgeon or an well, I guess you could call Dr. Messerly an orthopedist, but he's not a surgeon. Usually when you say orthopedist, you're talking about surgery, so an orthopedic surgeon. All right? An ATC, that stands for athletic trainer who's certified. I'll get to that in a minute. I'm sorry I called you. Exercise physiology, very interesting line of work. It's also with biomechanics. Those people tend to be in research. So if you go to a college, say where I went to for my master's in athletic training, we had an exercise physiology department, and they would be constantly doing research studies on us students, the athletes in the college. This was like a Division I AA school, so bigger size. And so the exercise physiology students and professors would be doing studies. So I'd have like big tubes in my mouth, I'd have a blood pressure cuff, I'd be riding a bike. Sometimes they were taking blood. It just depended on the different research studies. So a lot of those people tend to stay in the research end of things. Sports nutritionist, huge thing right now. If that's something that interests you and you want to take it to a sports aspect, a lot of bigger colleges, like your Big Ten, Division I schools, are hiring sports nutritionists to be in their schools and set up the eating plans for all their athletes. Very big business right now, very big business. So again, sometimes you got to find what you like and then find a way to wiggle into a setting that you like. All right? So I was talking about grad school. So after I got my bachelor's and I decided I wanted to go back to school, not every line of study allows you to go on to the next degree. So if I wanted to go back and get my master's in nursing, but I have my bachelor's in something else, I can't walk in the door and say I want to get my master's in nursing. That doesn't work that way. But at this particular time, I was able to walk into a school and go, I'd like to get my master's in athletic training, but I have my bachelor's in nursing. I didn't have a lot of schools that let me come and talk to them. I had one school that came and let me talk to them, and that's where I ended up going, and it was a perfect fit for me. So I went to grad school. While I was in grad school, I was working as a nurse. So I worked very, very hard for about 2 to 2.5 years. And then I did a year-long internship at a Division III college in Ohio. Very, very intense, a lot of sports at this Division III school, not very good sports. We had about swimming, was I think, and men's soccer. That was about the only thing we really excelled in. But I got exposed to field hockey, lacrosse. Lacrosse wasn't in Wisconsin back then. So I didn't know anything about those sports, so I got exposure to that. I could have went on the road with field hockey to Australia that summer, but I actually had already picked up my first job. So I would have been traveling with the U.S. Field hockey team, but I had to pass on that. After that, I got my first job, and I was in Indiana, and I worked for a physical therapy clinic, and I had 3 high schools. I did a lot of community work. I lived out of my car, basically. After my first year, I dropped one of my schools. We hired somebody. I was the first athletic trainer they hired at this clinic. And so I kind of got to set up the whole process, how everything got done, all my own paperwork. It was kind of nice. I got to kind of set up my own rules. And so then I stayed there for 7 years. And then I wanted to get into a high school because I wanted to teach. And because I wasn't a certified teacher, I had to find a different way. And so I went to Illinois, and Illinois has a program where if you can show that you're the right person to be teaching this content, they send you and you can get your certification in vocational teaching. So I was teaching only what was on my agenda. Does that make sense? I didn't go into the math class and teach geometry, okay, because I wasn't certified for that. So I was allowed to set up my own class, and it was like a college course. A lot of times kids would come back from college and say, your course was harder than my intro to athletic training. So I was pretty persnickety. I'm pretty intense about anatomy, physiology, just a lot of things, and it was a really good class, and we had a lot of people get out of there who became doctors, nurses, athletic trainers, physical therapists, registered dietitians. It wasn't all athletic training, so it was kind of cool because kids came into it just because of the health, and they like sports, so it was a nice combination. And I stayed there for 9 years, and I worked for the school, so I was there all day long, and I covered almost every sport that was on if there was freshman tennis, I stayed. So I was there all the time that there were athletics going on. Again, a little difficult because your time is very well utilized at the school. You don't have a lot of downtime. A lot of Saturdays, a lot of holidays. We had a lot of basketball there, a lot of basketball tournaments. So I kind of lost my love for basketball after that job. But I was there for 9 years, and then I came here. And this is my 11th year. So if you do the math, that means I'm very old. So the main thing that when you're talking about what an athletic trainer does is boy, that's really sad. That is a sad slide. You're kind of the middle, especially at this setting, what is called a secondary school setting. You are kind of the middle that's trying to communicate to a lot of different people. You can add teachers in here. People with concussion who are having trouble with their hearing may not be able to handle band. So there's a lot of things that I have to try and help with an athlete to make sure that they're being taken care of. So you could add teachers on here. You could have, under the physician, you could add physical therapists, chiropractors, massage therapists. A lot of people are getting their own personal trainers. There's a handout in your packet there that talks about, the word trainer is a really difficult word for me because I don't train horses, I don't train dogs, I don't personally train people, all right? I am actually, when you talk about an athletic trainer, they are in the same level as nurses, physical therapists. We're called allied healthcare professionals, all right? I have a degree, I have a certification, and I have a license to do this job in Wisconsin. So I don't just tape ankles. I don't just give people Band-Aids. Sometimes that's what people think, because that's what they see. When you see me on the court or you see me on the field, a lot of times you see me taking care of blood, those kinds of things. You don't necessarily see what goes on in the room unless you've been there, all right? And if you spend a lot of time in there, all right? So that's, it's a hard job at this level. A lot of times college athletics, a lot of college athletic trainers who I've got friends who are in bigger, bigger colleges and stuff, and they go, wouldn't want high school for nothing. Kind of like middle school teachers tell high school teachers, I couldn't handle high school, and vice versa. Nobody likes to go to the middle school to teach. Because middle schoolers are crazy, right? You remember when you were a middle schooler, you were a little nuts? But there are teachers there who think there's nowhere else I would rather teach than middle school. Same thing with athletic training. Got a lot of people, why don't you want to go to the pros? What do you think happens at the pro level for an athletic trainer? What do you think might be the things that could be looked at as negative?
Ending a career.
Absolutely. And you gotta treat that personality. You're on beck and call. You got some pretty, again, we have it here where we've got some people who think they're pretty good, pretty hot stuff. And they're a little difficult to deal with. But can you imagine somebody who's making millions of dollars? Now, somebody said to me that there's a question, would Mike McCarthy lose his job? Okay, the head of the Packers, the head coach of the Packers. Guess what happens when a head coach leaves a team and a new coach comes in? Anybody have any idea what happens to the staff? The majority of times they clean house. So if you are following, let's say this coach had you as an athletic trainer at his college where he was the head coach, and he gets the call to come up to the big leagues, and he wants you to go with him, and he doesn't last a year, you probably don't last a year. So now you have to move yourself to another, because you're going to probably move to a different city. So again, there are trade-offs. There are trade-offs. It's very rare that you see athletic trainers staying with a team. Now at the Packer level, there are some athletic trainers who have been there forever. And they've just even taken on different roles. Instead of the head athletic trainer, they're taking a different part of the role in the healthcare of the athletes. But they've been there for years. Pepper Burris is the name that I'm thinking of. There's also Flea. I can't remember what Flea's real name is. He's been there. He was a student, then he became an assistant. Now he's the head athletic trainer for the Packers. Again, very rare that an athletic trainer will stay with a team like that. Okay? So, typical duties of an athletic trainer. On any given day, you could do a little of everything. All right? But typically, you're preventing injuries. A lot of times, you'll see me, like if I'm walking on a field and I see a ball sitting where somebody might run and step on it, or I see something about a piece of equipment that somebody could easily run into if it's not moved off of the way. So lightning. I am the devil when it comes to lightning, and people get very angry. But I have seen where lightning has come out of the blue sky and struck a tree on an athletic field. It was before I had gotten to this school, but every time I said, hey, there's lightning, that coach who had witnessed this, he would run. He would grab the kids and run. I never had to worry about him because he had witnessed what lightning can do. All right? So I'm often being yelled at about lightning. But I'll tell you what, it's a lot easier to be yelled at than to make the phone call that somebody got struck and has been killed. Evaluation of injury. Obviously, that's where I spend a lot of time. Do I have an x-ray machine? Guess what what's the one line everybody walks in with? Hurt their finger, hurt their wrist, hit their hand. What does somebody say? Do you think it's broken? Well, let me get my x-ray eyes out. Obviously, if something is sticking west, maybe. Your finger, if you walk in and you're like this, well, there's something's probably wrong. Now, again, that's where an athletic trainer has to, be very careful. Because what could it be instead of, someone goes, oh, I dislocated my knuckle, I dislocated my knuckle, and you pull on that, and it wasn't a dislocation, but it was a fracture, and now that fracture has shifted, and now that kid's going to surgery because they got to pin it to hold it back. So I've had a couple coaches, just pull on it, and then they pulled on it, and there was a mess.
We had that case last year in my flag class.
Oh.
Remember when
Oh.
he came in with the hand, with the finger, and we were in an invasion game, and he said, just pull. I'm like, it doesn't look that good. So I sent him an SP, and then she sent him in, and he had the fractured hand. They had to pin his finger and everything.
Yeah, that was a bad fracture, so it didn't need anybody pulling on it. It was already messed up. If you come to the training room, there's actually a little x-ray up on my bulletin board of somebody here who had a spiral fracture. So it kind of spun around. It was a twist that he twisted his finger already, and it cracked it like in a spiral staircase. And then the next x-ray is with the pins in it, putting it back together. So again, yeah, you've gotta be able to look at something and understand your anatomy and go, you know what? I don't think that's a dislocation. I'm not touching that thing. And make sure you get them to the right people. The other thing is understanding who the right person for a job might be. There is one spot on your hand, or at your wrist, okay, where you don't want to get broken because that bone has not a good blood supply. And if the fracture is missed, which often happens, because it doesn't like to show up on x-rays. So you have to make sure you understand how to evaluate that area. And a lot of times kids are treated as though they're fractured even if we don't see it on x-ray. But if you send that person to somebody who may not know that information, oh, you're fine, you just sprained it. And now 4 weeks goes by because you can't convince anybody to go back to the doctor. Now it might be too late. And that bone might die, and it might be having to be taken out.
My second son had that, broke his wrist in Little League baseball, and it was 7 months later before we finally said, you know what, let's go get it checked. So they had to do a bone graft because the bone died. And this is Dr. Glennon.
Dr. Glennon,
Had to do
hand surgeon,
orthopedic
hand surgeon. Yeah, so again, it's not always understanding what you can do for somebody, it's understanding what you can't do for that person and making sure you try and convince a family where to go to get the right help, all right? And again, do those people make mistakes too? Yeah, things happen. But I'm telling you, there are a lot of times where there are certain injuries or certain illnesses that I say, I really, really, really want you to kind of go to this kind of person so that we make sure we get the diagnosis as quickly as we possibly can. Does that make sense? Treatment, of course, that's what you see me doing a lot of. Treating boo-boos, treating blood, providing first aid. Knock on wood, we've been very blessed here at Wausau West. The scary stuff that happens in sports has been very, very, I'm not a knock on wood person, I'm very suspicious, or superstitious. We've been very lucky that way, but again, got to understand first aid, AEDs, CPR, which you guys get training in, which is awesome. Because again, guess what happens? If it's hitting the fan, and I think I remember you from a class, I'm probably, hey, go to my room, get the AED, okay? You might get called into action, so be ready. Rehabilitation of injury. This setting is not meant for a lot of rehab, but there are some things, whether it's because of insurance, because I think, you got a little problem with your range of motion, but I don't think it's huge. I'm going to give you a couple exercises, and I'm expecting you to do the work. What happens at this level, kids don't always do the work. And so I can't chase everybody down, but that's one of the things that I do try. I do try and give some home programs for people who I think if they just did a little work, things are probably going to be okay. I don't think they need big time rehab, but there's other times where I think this is exactly what you need. I really want you to go somewhere else. I don't think I'm the right person for this particular job. Whether it's because of the season we're in, it might actually be the injury or the problem, and I might feel that I am not the best person. We don't have anything fancy here. We don't have ultrasound. We don't even have a hot pack machine. We have ice, and we have these. And you know, we've got the weight room, but the weight room is also not necessarily designed for rehab. I stole a bunch of stuff from my last job, and once that stuff's all gone, you know, then I'll have to probably try and steal somewhere else. But like rubber bands and tubing and weights, little ankle weights and things like that.
When I went here, we had the hot tub and the cold tub. Is that something that's gone? I mean,
No, it's not, we don't have a setup for it. You gotta have a water source, you gotta have a draining source. And I think with how they configured you'd almost have to
It used to
take,
be in the ice room.
well, that's where it would have to go back to, but I think they wanted that to have space. Now, if I had, like my last job, I was very lucky, I had a whole half of like a quarter of a room all to myself, like a big weight room. They had a quarter of it was mine. So I had a big hot tub, which surprisingly, kids don't really want. It's not like going to the hot tub at your friend's house. If you're like, do I have to go back in the tub? No, you don't have to. But I had, what was more important was I had a little baby one for feet and ankles and hands and elbows. Perfect for that. I use that more than I ever use the big tub. But yes, no, there's a reason for it. But if I had to pick, I would go with the hot pack machine first. But that also is a water source. You have to have water, and I love a sink. I don't have a sink. You know, that's why my hands. If you ever see my hands, they're just trashed because of hand sanitizer. And there's only so much hand sanitizer you can use because then it starts to feel like it's tacky. You're like, I just gotta wash my hands. I feel dirty from the hand sanitizer. Organization and administration. Right now there are, I don't know, probably 10 boxes in my room. They're all full of supplies because I make the supply orders for the med kits that you see at games that a coach might be digging through if I'm not around. Or you're in the training room and you see all the boxes of tape and Band-Aids and gloves and all. I do all that ordering myself. So I just put an order in, so all those supplies just came in today. So I've got to go through all that, put it all away. Administration, you're also gonna, how many of you have taken the impact test? Okay, that's administrative. Figuring out who needs the impact, when they need it. Right now I'm starting to organize all the winter sports who are gonna need impact testing. Which is concussion baseline, a concussion testing program. So that's administrative. Figuring out what games I'm going to go to. All right. So if I have football and I have girls tennis, and I'm not trying to say one's better than the other. What am I going to?
Football.
Football. Why?
It's more dangerous.
There's a lot more risk for injury. Do you get concussions in tennis? Yes, we've had them. Do we get bee stings in tennis? Yes, we do. I'm picking on somebody. Do we have shoulder problems? Do we have ankle sprains? Do we have, yes. But the risk is a lot lower, a lot lower. And the impact, there's no impact. There's no collision, all right? So again, now what happens when there's football, soccer, volleyball, and tennis all in the same day? Now you see me being very stressed out, okay? And we just do the best we can. Sometimes we get help to come in to help me so that we have enough coverage everywhere. Because I don't know if you've ever been anywhere where you see the gator just flying from field to field trying to get to kids. There's one day where we had 2 football games, 2 soccer games, volleyball, and tennis going on. I don't know what year that was. And we had big injuries on the football. Actually, I think we might have even had, did we have 3? I can't remember how many football games, but we had multiple concussions, multiple major knee injuries, and it was insane. It was insane. And I'm going back and forth with the gator, and people are running after me, chasing me on foot. You gotta come back, you gotta come back. Somebody just hurt their... So it does get a little crazy. And those are the days where you're like, holy buckets.
So regarding, let's say our football scrimmage, do you try getting extra help for that?
Well, actually, a lot of the schools bring their own athletic trainers and we stay up by the varsity, so the Anago athletic trainer was there, the Merrill athletic trainer was there, I was there. I don't think, Eau Claire North brought their person. I think every single athletic trainer was there for their team, so that made it nicer. We did not have a physician on site, which is usually nice, but that's a surgery day. Well, there aren't too many physicians who are going to give up their clinic surgery days because a lot of times they're booked. So, but yeah, that makes that day so much nicer. There have been a day or two where we were hosting and we didn't have nearly enough help. Great question. Counseling and guidance. You'd be surprised. We have a lot of people who, whether I've had kids come in who were abused and who had broken. Yes?
So the busy days, that when you bring in like Dr. Marcel?
Sometimes, like so for wrestling, when we have the big middle school, junior, middle school, high school tournament, the number of kids, and so what I do is I often bring in a physician who doesn't like blood. He doesn't like blood, so I'm always on blood. I make him do all the concussion assessments, and we kind of split the difference on the other stuff, shoulders, knees, and things like that. And we just we divide and conquer, because we got how many mats on that day?
12.
12, and so you got little ones, like, so cute, little kids.
That's our youth tournament too.
Well, yeah, but I don't do that anymore. But, yeah, I don't need to do that one. You know, from here to here, you know, so our rule is usually if you're crying, you're probably done. So if you say you hit your head and you're crying, you're probably done. Because it's hard to evaluate an 8-year-old for a head injury. You know, it takes some time, it takes some skill. So, yes, there are some big events that every year, I'm going to get help. But for counseling and guidance, there are many times where you'll see me, I'll take somebody into a room, we'll shut the door, and you know, whether it's a home thing, it's a coach thing, it's a teammate thing. Some kids today, I find I have more kids who are clinically depressed and have anxiety disorders than ever before. I don't know what that means. You know, the first time I saw somebody with cutting, you know, you're anticipating anorexia and bulimia. I'll be honest with you, I see less of that, and I see more of the cutting. I see more of the depression and anxiety than I see of the things that we used to see back 20, 25 years ago. And the stress you guys are under as athletes and school, social media, I think the problems that I see as an athletic trainer are different. And the things that I talk to kids about are different than they used to be, which is kind of bizarre. But there are things that I need to know. I've had a